participate in the survey because their school does not teach LGBTQ plus health because it's a faith-based organization. It was a Catholic institution. And the interesting part was their mission was that they take care of everybody. And I thought, okay, well, that's a disconnect right there. If your mission says you want to take care of everybody, but we don't want to teach certain topics, that's problematic. A stakeholder. So we are all aware that sometimes what happens is sort of operated behind boardrooms and stuff like that, and they can tell us and dictate what we should and we should not do. So on the next slide, I wanted to just remind our audience about what are the components of the nursing curriculum. And by the way, when I was looking at the chat earlier, I see that there's a lot of midwives participants today. So I'm excited about that because maternity, labor, delivery, nursing is something I'm not very familiar with, except when I went to nursing school. So we have in nursing lectures, we have the practicum, the hospital clinicals. We have simulation and whatever that might look like and where you are. It could be a high fidelity simulation, etc. And then number four, all the other stuff, the seminars, the webinars that our students do on their own, if you have some hybrid format, etc. So if you think about putting this into your curriculum, think of where you might want to put this in based on this items. And there could be more of these. So on the next slide, I want us to consider on the framework, right? How do we want to put this in there in the midwifery curriculum? So we want to teach LGBTQ health, and we don't really know where to begin with. But I think a lot of us are already doing this. So minority stress principle or concept, it calls attention to the chronic stress that sexual gender minorities may experience as a result of stigma. So when I teach this to my students who are undergrad, I teach in the undergrad primarily, but I also now teach in the nursing education master's program. So I'm teaching the teachers, the future teachers. So I try to connect minority stress with what they learn with pathophysiology. So I would ask them something like, what do you think happens to the catecholamines or your stress hormones when you are exposed to stress? So now they have a way of putting this and connecting this to their current learning. And minority stress is a concept that's taken from the experience of minoritized population, originally from ethnic minorities, but now we know that this is true for any type of minority stress identity, minority identity.
Πώς ανοίγουνε, ρε Χρήστο?
So life course perspective is the idea that what happens at one stage of our lives affect the next and the next until the end. So those of us who are teaching adolescent nursing or maternity nursing, we try to imagine what happens to the birthing experience, for example, and how it might affect the next level of stage for the mother and for the child. Intersectionality perspective is the idea that we all have multiple identities and the way they interact and interconnect with each other.
Πώς
So,
ανοίγουνε για να ακούω?
for example, I identify as a nurse. I identify as a male nurse. I am an immigrant in the US. I am middle-aged.
Μην φωνάς, δεν ξέρω τι ακούνε.
I'm male. I'm gay male. So all of these affect the way we would want to teach this in school, because when we think about our patient as a whole, in the hospital, it's a very different scenario as when they leave the hospital or as when they're trying to connect all the aspects of their lives. So by looking at intersectionality, we're able to see the patient as a total person. Then social ecology, it is the idea that there are multiple layers of influence in someone's life. So I typically would ask my patients, my students, I ask my students, have you ever wondered what happened to the patient after they left the hospital? Okay. What happens to them? Have you sometimes wondered how they got on after you have taking good care of them in the hospital, right? So they go back to the community, they go back to the town, to the city, to the street where they live. And what is that like? So, what I'm trying to illustrate here is in the hospital, we could be doing the right things. We could get our pronouns straight on. We could provide respectful care. We could provide the best evidence we could possibly do to address health issues in general and LGBTQ health in particular. But if they go back to the society and then experience the same prejudices and discrimination, then we're not really truly successful with that. So on the next slide, I want us now to think about nursing courses. So now I'd like to ask the audience if you can just type in the chat box what type of nursing courses are you teaching right now? Currently, if you are teaching nursing, if you're an academic, I just wanted to see what courses most people are involved with. So I teach, for example, what we call medical surgical health in the US. And I also teach geriatrics and critical care and nursing education. So I see midwifery, contraception, undergrad, post midwifery, pre nursing, great, maternal and child, and I see, okay, interprofessional, that's great. Yeah, psychology, communication, adult nursing, simulation, great. That's wonderful. So thank you for the responses. So the names of the courses would, of course, be different depending on where you're teaching. So what you see on the slide are just the more well-known names of these courses. So now, if we go to the next slide, we will see a what we call here in the US the four spheres of care, according to the American Association of Colleges of Nursing, that there are four areas when we teach nursing. There are four areas where we should put in together sort of interrelated arena of making a difference. So on the top left, wellness and disease prevention. This is one of the things that I'm very keen on, because very often when we teach LGBTQ health, there is a lot of emphasis on pathology, right? HIV, mental health, suicidality. So when I want to teach about LGBTQ health, I would like to see more attention on the wellness and health promotion. How do we keep ourselves healthy? And I tell my students, an LGBTQ person stays healthy the same way as everybody else, right? Eat 5 servings of fruits and vegetables a day, drink a lot of water, or check your blood pressure, those types of things. So it's not different. And chronic disease care. So here we're talking about the usual suspects of dementia, heart disease, cancer, and I want them to sort of understand what is the LGBTQ scenario, how is it going to change the chronic disease care? Uh, Restorative, regenerative, so this is somebody's recovering from surgery or a major healthcare event, and hospice and palliative care, end of life care. So that's sort of how we conceptualize. So even, for example, if you are teaching a very specific topic, say labor and delivery, you might say, well, is there, all of these components, or is it found there? Probably not, right? We don't think about hospice and palliative care typically in maternity nursing. So, but I want us to sort of have an expanded view of this four spheres. So on the next slides, we see a prompt asking us, so what do we want our students to learn? How do we want to see this LGBTQ health synthesized in the learning outcomes? So I won't go too much details on this. We all know our Bloom's taxonomies, um, and so we want them to have some cognitive outcomes, affective, psychomotor, and this can look very differently in different practices. So for example, a cognitive that's you're talking about specific healthcare disparities, affective. This is sort of your communication, your behavior, uh, reflection, outcomes, psychomotor, the hands-on, right? The skills, psychomotor skills. And recently I had a question from a student asking me, how is inserting a urinary catheter different from in a transgender person, right? Somebody who might have had vaginoplasty or phalloplasty. Tell you the truth, I don't know the answer to that because it depends on the type of the surgery, right? So that's a kind of questions, that's kind of prompt that we should be thinking about. So teaching students to uh, practice urinary catheterization will look very different if you want to synthesize the transgender scenario. So I want us to think about how your courses learning outcomes are different when you put in the LGBTQ health. So on the next slide, we have the assumptions of adult learners. So when I say adult learners, I think that's everybody in nursing school, but the age range of our students are very different. So in my university, about 80% of our nursing students are what we call second degree students. So they have prior bachelor's degrees, they have former careers, and they pivot to a nursing career. Then we have 20% those who came from high school. So although they are all adults, they are in very different stages of life. So the adult learning principle is the idea that adult learners have self-concept, self-directed ideas. So they are more independent learners, right? They know what they want to learn. They have with them a lot of life experiences, and that's usually, for me, a good way to get to know my students. Many of them have experiences of LGBTQ intersection. What do I mean by that? They may have family members, they may be in a relationship, they may have had even prior expertise on this. The readiness to learn, that someone wants to learn because they are at a stage of their life wherein the motivation to learn is very different than when you are, say, a teenager. The orientation to learn is, I want to learn something that I can use. I want to use my learning to solve problems. So this is all very important when we're trying to teach very, very specific topics. So on the next slide, we will see a general guide on how do we integrate um, the LGBTQ plus health. So of course, we all know it has to be meaningful and relevant. And so this is sometimes hard to do with our students. So for example, a lot of our students don't really go to community health nursing classes because they think it's not very relevant to the career they want to do later on. So, and I am kind of saddened by that, but that's just the way things are. So we want to put the topic that's meaningful and relevant, and we want to do it in an active learning, less passive lecture type, but rather more active learning ways, which we can talk about later on in the next few slides. We want to give them the science of what the evidence is. As much as possible, we would like to be in an interdisciplinary education. And the reason I say this because I think a lot of the expertise in LGBTQ health is probably not in nursing, right? It is probably in many different other healthcare professions, social work, medicine, uh, and psychology, those types of things. So it is important that we tap the resources that's available for us. It has to be sustainable. So in other words, it's not a one-off thing. It's not a seminar given once and then never happened again. And then the idea that we are going to teach this and we want to measure that our student actually has the competency to do this, and that's very difficult to do very often. How do you know that they know and they have learned something? So on the next slide, I put this in here. This is the got this from the internet. The leading causes of death in the UK, 2022. And I do the same when I'm presenting this, but I put the US data when I'm teaching this in the United States. So you look at dementia, heart diseases, etc. So very well-known information. So I ask my students, can you imagine how is it different to take care of somebody with Alzheimer's dementia and they are transgender? How is it different? Okay. So how is the care different in somebody who has COVID, for example? So I want them to reflect and sort of visualize and imagine the aspects of care. So very often they might say, well, it's probably not different from the care of non-LGBTQ person, but that's just half of the story. So this is sort of a prompt for conversation. And depending on the response, you can take the conversation to a different level um, or to the next level. So on the next slide, I did a review this year. So I looked at the literature and I wanted to know how is transgender health being taught in nursing curriculum. And I found about 28 studies out there. And on the left, you will see the most common, and on the right, the least common teaching strategies. So about 50% of the studies I found uses primarily lecture, right? Didactic, one-way passive lecture. Role play simulation is the next video, etc. So, and I want us to reflect on this when we are planning an educational activity. How do we want to teach uh, transgender health? My focus of my studies, I was more interested in the transgender health. Okay, so how does it look like? How can we make this more meaningful and more accessible and more impactful to the students? So a lecture is the default way to teach across the board, no matter where you are. But there are other ways on how we can do this. So a guest speaker. So during the COVID pandemic, the whole academia has been turned upside down. So they had me teaching perioperative nursing. Okay. Now I was never a perioperative nurse, but because of just the need, I took on that role, and it's an elective 3 credit course. So I invited the liaison to the transgender health services of my hospital, and he did the presentation on the experience of the person who is having phalloplasty, for example. And that sort of really came to life because I don't have that kind of expertise. So I want us to think about where can we find the expertise who's able to provide the type of educational experience that is more meaningful and more relevant. So whatever that might look like, standardized patients on the right side. So for example, my colleague um, used transgender standardized patients as as a patient in simulation, and that changes a lot on how our students react to the scenario, even if the scenario is not about transgender, but the person portraying the role is a transgender patient. So on the next slide, we will see some of the uh, examples on where we could connect uh, LGBTQ health related topics. So in fundamentals of nursing here, we can talk about pronouns, inclusive language. In pathophysiology, and this is one of my focus when I teach critical care, thinking about the allostatic load, the stress response in relation to the minority identities, and you put on top of it the critical illness. And you can imagine a person, a transgender person who is in the ICU, who is in a ventilator. How is that different? What's the difference in the allostatic load? Professional nursing, we could talk about LGBTQ history, and here many of uh, the pioneers of LGBTQ health integration in the US, at least, were mostly lesbian nurses, and it's sort of a part of the history that's not very well acknowledged or talked about, um, and the 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 background of HIV/AIDS and the early roles of nurses, and then the other thing that I mentioned is also about historical figures in nursing who might be LGBTQ. Health assessment, we're talking about screening and testing. And here I emphasize if we screen and they have the risk, we have to test. We don't test everybody for HIV simply because they are gay, right? Because that continues to perpetuate the notion, the negative stereotypes. And in medical surgical nursing, we're talking about healthcare disparities, and there's a slide later on about this. So the idea is, say you're going to teach cardiovascular disease. So think about the unique healthcare disparities that might be specific to LGBTQ, and then put that in the slide, because it's so difficult these days to have an independent LGBTQ nursing course. So by weaving it in our existing courses, that might be a good way to integrate this without adding another extra course. Pediatrics, a big discussion in the US is about hormones transitioning as youth. When we say youth here, at least we're talking about the 13, 17-year-old. Bullying in school, pharmacology. I teach gender transition hormones in the pharmacology classes, antiretrovirals, and all the other related pharmacological interventions that might impact LGBTQ um, uh, scenarios. On the next slide, we got more examples in here, and I'm sure the slides will be shared for you, and you can see this in labor and delivery, the filling out of the birth certificate, what language are in there, pregnancy among trans men, and hormones use or discontinuation, or those types of things, depending on the maternity scenario. Psych mental health, and here I put there, avoid diagnostic overshadowing. Diagnostic overshadowing is this concept that if you have a certain diagnosis with you or a certain um, identity, they think that all of your problems results from that. So, and nobody's thinking that this could be a different condition. So, if somebody is living with mental health issues, they will say, oh, well, it's because of your mental health issue. If you're LGBTQ, they will say, well, it's related to your being LGBT, but it may not be. But you could miss out a lot of things. And nursing research, they could do projects, community health nursing, send them around the block and look around what LGBTQ resources are available. So community assessment. So very often they will, look around for the healthcare center, where the senior center, where the hospital is, but no one is looking at the LGBTQ resources. So geriatrics, one of my favorite subjects. I talked about social isolation, loneliness, and how it interacts with living alone and not having the social capital of children for those LGBTQ elders who never had the chance. So on the next slide, we have some sort of prompts in teaching a class. So, okay, many of us are probably doing this already. If you haven't, well, our audiences, our learners are very different now than they were 20 years ago. Those of us who've been doing this for a very long time could attest to that. So now everybody is likes videos, multimedia, TikToks, or whatever it is that people these days, young adults, well, everybody is using. So lecture is not enough, right? We have to get some innovative ways to teach this in whatever format, electronic, face-to-face, at the bedside, etc., experiential. And student as a co-creator of learning, as we have seen before, the adult learning principles, they're not just passively absorbing our information. Very often I begin by asking my audience, how many of us know somebody who's transgender or gay person? And I begin by saying there's about 7 gay people in my family and 1 transgender. So I give them time to talk with their sitmates and think about what is meaningful for them, what they would like to know, what are the topics that they have come across that are not covered in the curriculum. Then we have some case studies, as we saw previously. Adults like to solve problems. Right? So just giving them the information without the opportunity to use it, whether in uh, uh, real life cases or a made up cases. Flipped classroom, this is one of those harder things to do. I teach a very large class, about 150 people. It's sometimes hard to do this, but we want them to be doing something. Okay. And then as a faculty, this is sometimes tough because topics such as LGBTQ health can lead to certain vulnerability, right? It could be triggering for some of the audiences, right? So I, I, I sometimes share that I lost one of my nephews to suicide because of his sexuality and his HIV status. So from time to time, I share that information. Sometimes I don't because I'm afraid that it might trigger or it might upset them. But then again, you have to be vulnerable when you want to talk about this difficult conversation. So see what's comfortable for you and how you want to integrate this in your discussions. So on the next slide, we have some examples in the clinical practicum side. So I did bedside clinical teaching for many, many years before I became full-time faculty. So thoughtful patient assignments. So what do I mean by this? Nowadays, the patients are who interface with the hospital, they usually are asked what their sexuality is. I think it's not uncommon. And so if the clinical faculty knows that a patient might have LGBTQ scenario about them, it might be a good chance to allow our students to have interaction with them, right? So with certain concentration that the patients are not there to teach us, right? They are not. It's not their job to be teaching us, and this is a lot of ethical issues with this in teaching hospitals, right? Most people think, okay, because you have a heart murmur, everybody should go listen to your heart sounds, and that's not really um, the job of the patient to teach. So if we go to the next slide. Um, so we also have something called dedicated education units. So some of our students gets to spend a semester in the gender affirming surgery unit, not by choice, but because we use it as a clinical site. So my students in the critical care uh, course goes to the post anesthesia care, and there they have an opportunity sometimes to care for a patient immediately after phalloplasty or vaginoplasty. So, and that's experience is usually very remarkable for our students because they just have never thought about the specificity of the care. Partnership with community-based service. A lot of LGBTQ health services are not in the hospital. So you got to be creative in where you want to send your students to have those types of meaningful experiences. Nurse interview survey, so you can either do an assignment and have your students interview a nurse in the hospital and ask them about their experiences at all if they have, or look into the policies of the hospital that might be supportive or unsupportive of LGBTQ health. So it gives them the idea of policy and how to change the current status quo of practice. On the next slide, we have some suggestion for simulation. So high fidelity simulation, always a good thing. Our mannequins are so evolved these days, but there are still limitations for that. So um, I want us to consider how we can synthesize this. So we would create a background information of the patient who may come from diverse family scenarios. So a patient with two moms or two dads, um, a patient with a transgender parent, for example, or and I'm talking about putting the gender scenario not as the primary topic, but it's there to say that this is how diverse our patient population is. But you could also develop a scenario that's very specific to LGBTQ. In my school, we have scenarios very specific to trans care and disability, for example. Right? So if you're using patient actors, transgender standardized patient, that's an opportunity for our students to interface with them. And so again, this requires some preparation, some training, and it involves cost as well because you have to pay the transgender standardized patients, like every standardized patient. Uh, Pre-sim activities or post-sim activities that might be related to a follow-up learning. So that's always great to do spread them out in different aspects of simulation. So on the next slide, we have a slide to bring our attention to specific issues in medical care. So the picture on the right side is Thomas Beatty, who is the first male who became pregnant, right? Uh, Thomas Beatty is from Hawaii and married and decided he's a trans man and affirmed man, and he had pregnancies. So I think he had three pregnancies. So when I want to teach this to my students and raise awareness, what's our chance of having patients like Thomas Beatty? Well, if you don't work in labor and delivery, maybe not so much. But then again, what if you do? What do we? What kind of competencies do we want to see our students? So and I talk about reproductive health, so prostate cancer, breast cancer, those types of things. So it's all yeah, um, very specific. So you will have to teach the specifics of it. So on the next slide, looking at my time, and I won't go over to so much of these because of the interest of time. Inclusive language is one of the new frontiers of academia, is trying to get our inclusive language. So I won't uh, go over so much of these, but if we go to the next slide, um, I have a question. We don't have time to answer them now, but I just want us to think about how are you already integrating LGBTQ health in your course right now if you are doing this already? So feel free to type in something in the chat box, and maybe the audience can read them. But it's I'm always learning from others, right? I don't pretend to know everything on how to do this in teaching, but I always go to conferences and pick up a few things that I would like to try. On the next slide, I had found that in the UK you have something called revalidation, which I think it's a fantastic idea. And I was asking Frida last week about any regulations in the UK, and she referred me to this site. And I thought this is a great way to synthesize LGBTQ health, particularly for those of us already in practice. So you see 35 hours of CPD and 20 hours being participatory learning. I don't think we have something similar in the US with this. There's one state, the state of Washington, D.C., requires all their healthcare workers to have an LGBTQ health um, continuing education before they can renew their license. But I think that's the only one in the US that has that requirements. And on the next slide, and I'm almost done, here are some other actionable items. Hopefully, when we go back to those nerve-wracking faculty meetings, we can talk about curricular crosswalk, right? Your team would look at the courses and say, where is it? Where is it? Where should it be? The LGBTQ health. And you're talking about faculty development. I say, in the hospital we have to learn CPR every 2 years. Why don't we have every 2 years or every year training on specific topics? LGBTQ health being one of them, right? If you are a researcher, think about educational research, elective courses. And here's something that I'm kind of two minds about, and I throw these questions to the audience. Do we need a specific standalone LGBTQ health, or do we not? Okay. So my thoughts on this, if and my school actually has one, and University of Pennsylvania has another. So when you create a special course just for LGBTQ health, sometimes our students think that it's only for those students who are interested in that topic, when in fact LGBTQ health spans the whole lifespan. So in other words, it should be part of the entire curriculum, not specific to as a standalone topic. So we can debate on that but today we don't have time. So put it in the exam, in the revalidation, so that people will actually pay attention or at least have some prompt for it. And on the next slide, give you something to reflect out there. What's nursing doing out there? And we have a picture of Florence Nightingale, and I'll end by saying that Nightingale has been posthumously been outed either as a lesbian or might even be transgender. The book that came out in 2008, The Making of an Icon, has a chapter there uh, entitled Your Vagabond Son. For some reasons that are not understood and will probably never be understood, Florence Nightingale used to sign her letters, "Your vagabond son." Okay. Now, you'll have to read the 800 pages book to know what they're talking about in there, but that's something to think about. If our founder of our modern nursing, and of course, she wasn't the only one, there are many other nurses out there, pioneers. So I'd like us to think about that. And in 2010, they say, well, nurses lag behind. So where are we now in 2024? Have we made improvements? I think we did, and we are still continuing to do good work. So I'll stop there. On the next slide, I just want to say thank you for being here today. I'm very happy for this opportunity to be able to share what I know and what I do. So unfortunately, we don't have time for questions or so, but if you do, you can always find me at NYU. So thank you so much for having me.
Fidel, thank you. Fascinating. I was just sitting kind of reflecting whilst you were presenting there how sometimes the language in the US, I have family that live in the US, is slightly different. Some
Yeah,
of the language, the terminology, but the issues that you were describing, I think are the same. We're all experiencing the same challenges, the same issues, trying to address them, get stuff in the curriculum, which is never easy to find space in busy programs.
yeah, absolutely, absolutely. But I think if you have the commitment and the support, and I think Michael, you did a fantastic job. You and your team, and Frida, your organization, and trying to get this out there. So
Thank you
keep up
very
the good
much.
work. So
Is
thank you.
it is it okay, Fidel, if I pop your email address in the chat area? If anyone, I don't want your inbox to probably be more stuff than it already is. It's a problem all of us have, but people want, I mean, they could find you anyway. You're very accessible.
Yeah, yeah, that's all good. I put my email in there. I love hearing from people and learning from others. So it's all great. Thank you.
And again, if people have any questions, they can pop them into the chat for you, if that's okay.
Yeah.
So that was fabulous, Fidel. Thank you
Thank you.
so
I'm
much
gonna
for
sign,
opening
and
this
I'll,
for us.
yeah, we have graduation ceremony this morning, so I have.
Yes.
All right. Have a good day,
Yeah, you're
everybody.
looking very smart, and I hope you enjoy the graduation.
Thank you. Thank you.
Wow, wasn't that interesting?